it's my pleasure to introduce Elizabeth Hartel, Director of Michigan Department of Health and Human Services. Previously, Director Hartel was Senior Chief Deputy Director for Administration. Hartel joined the administration in 2013 as the Senior Assistant for Policy and Planning, and in February 2014 was appointed Director of Policy and Planning. Following the merging of Departments of Community Health and Human Services into MDHHS in 2015, Hartel served as Senior Deputy Director for Policy, Planning, and Legislative Services. In October 2016, she left that position to serve as Director of Michigan Advocacy for Trinity Health and returned to MDHHS as the Chief Deputy Administration in February 2019. Prior to joining, Hartel worked as a Senior Advisor for Health Policy in the House Republican Policy Office and as a Legislative Assistant to State Representative Bruce Caswell. She began her tenure in the House in 2005. In 2010, she worked as a consultant with Public Sector Consultants and then as policy analyst at Blue Cross Blue Shield of Michigan. She returned to the House in 2011. Director Hartel earned a bachelor's degree at Grand Valley State University and an MBA at Michigan State University. Welcome, Director Hartel. Thank you. I guess I can forward this for you. Thank you. Go ahead.
Good morning, everybody. It's pretty good, especially for everyone being in the back rows, just like in school. It's really early on Monday, so congratulations to you all for making it, and me too. I'd like to say thank you very much for inviting me to open the symposium today and to reflect on what we've accomplished and what we must continue to do to increase access to treatment for individuals with opioid use disorders. All of us know opioid use continues to be a challenge faced by states across the country, and Michigan is no exception. We were proud to partner with all of you, including the Foundation, to join what became the Michigan Opioid Partnership in 2018, award funding to the Community Foundation for Southeast Michigan for this work, and support the Emergency Department Medication for Opioid Use Disorder initiative. And like all of you, the governor and our department remain committed to reducing opioid use and deaths in Michigan, making sure that individuals with opioid use disorder, providers, and community organizations have the services and resources they need, and to build a continuum of care and supports that include prevention, harm reduction, treatment, and recovery supports. This work is not easy, but it is made easier by having a network of strong public and private partners working together in evidence-based treatment programs. Looking back at some of the progress that we have made in Michigan as a collaborative and through this initiative, in 2019, state opioid response grant funding was awarded to the foundation to support innovative, evidence-based treatment programs for people with opioid use disorders. It established a no wrong door approach to remove barriers to entry for people who need treatment. That same year, the first hospital-based emergency department medication for opioid use disorder, or as we call it, MOUD, as I was told, grant was announced. The following year, the initiative expanded to support 6 hospitals, and partnerships were established with Vital Strategies and Johns Hopkins Bloomberg School of Public Health, established to focus on evaluation and equity. In 2021, that support grew to more than 20 emergency departments, and a partnership began with the Michigan Health and Hospital Association Keystone Center to increase hospital engagement. That year also marked the beginning of a collaboration with New Detroit to address racial biases. Emergency department participation roughly doubled last year. And as of this year, total participation in the model from 2020 through 2023 totaled 75 emergency departments. That's around half of the state's emergency departments and our state's 10 prepaid inpatient health plan regions. That's a tremendous coalition building effort and growth in the span of just 5 years. 5 years of which, might I mention, also included a global pandemic. So congratulations on that work. At the same time, our department has been collaborating with many of you and other partners to advocate and support for additional investments and programs that align with the goals of this partnership initiative and our state strategy, and working through the distribution of opioid settlement dollars for a series of settlements. I'll highlight some examples within the framework of the strategy that I mentioned earlier, which prioritizes the needs of vulnerable populations, including people who are justice involved, pregnant, and parenting. In prevention work over the last decade has included efforts to educate the public, promote best prescribing practices, and address the unlawful supply of opioids. The Department of Licensing and Regulatory Affairs and MDHHS have been educating on the required use of Michigan's automated prescription system by prescribers and dispensers to assess risk and prevent diversion and misuse. The Michigan Collaborative Addiction Resources and Education System, a training program for family medicine and other physicians to recognize and treat addiction, has been impactful in expanding access to treatment and has provided training to hundreds of physicians throughout Michigan. Federal grant funding also allowed the implementation of evidence-based primary prevention and programming for youth and families across Michigan in a variety of settings, which includes schools, juvenile correction centers, and community settings. Settlement funds allow us to expand this prevention work, and the fiscal year 2023 spend plan for those dollars includes primary, secondary, and tertiary prevention efforts administered through our MDHHS Injury and Violence Prevention section in public health. A main focus of settlement-funded programming is addressing adverse childhood experiences, or ACEs, including expansion of the Michigan Model for Health curriculum used by educators and parents, the addition of ACEs questions to the Michigan Behavioral and Risk Factor Survey, education campaigns, and prevention curriculums for implementation with children and families. Funds also coverage linkage to care initiatives connected to quick response teams, which provide evidence-based programming, supports, and connections to resources for youth, families, and individuals that have experienced a non-fatal overdose. For harm reduction in 2020, we announced the launch of an online naloxone portal, which is available to any substance use treatment providers, nonprofits, harm reduction organizations, jails, first responders, local governments, and small businesses. At the same time, we also worked with Next Naloxone on a portal available for the public. The availability of intranasal naloxone through MDHHS's portal enabled the distribution of hundreds of thousands of naloxone kits into Michigan communities, resulting in an estimated 5,000 overdose reversals since the portal's launch in 2020. Thanks to funding from Vital Strategies in 2021, our department partnered with emergency medical service providers to launch a Leave Behind naloxone program that equips emergency services with naloxone to leave behind with a patient, family, and friends or bystanders at the scene of a non-fatal overdose. This was introduced in 4 counties with some of the highest rates of fatal overdose at the time, which include Wayne, Macomb, St. Clair, and Wexford. A few months later, we announced a partnership with the Michigan Veterans Affairs Agency and EMS to provide veterans with resources through the EMS Leave Behind naloxone program. This fiscal year, funding for continued support for the naloxone portal and syringe service program operations exists. In treatment, the availability of the Healthy Michigan Plan through Medicaid expansion in 2014 has allowed for more individuals to be served under Medicaid and receive substance use disorder services they would otherwise not be covered for or would need to be funded through other funding sources. In 2021, the department continued to expand the opioid health home model to new prepaid inpatient health plan regions. This provides a higher level of care management for qualifying in individuals with opioid use disorder and co-occurring diagnoses. It also offers a sustainable mechanism to reimburse for services that help individuals reach long-term recovery, such as increased care coordination, care management, and community supports. 2020, MDHHS implemented the opioid home health model in prepaid inpatient health plan regions 1, 2, 4, and 9. No, I don't know what those are off the top of my head, but we can easily look them up. In 2021, we entered the department, partnered with the prepaid PIHP regions 6, 7, and 10 to continue expansion of the health homes model. For individuals who are in jail or prison immediately after release, a person is as much as 40 times more likely to die from an overdose. So we've been working to expand this model treatment in jails and prisons and improve connections to the community after release. The department has implemented efforts to support workforce development to increase access to services, and the current year budget includes direct care wage increases and loan repayment programs for behavioral health professionals. In recovery support, our current fiscal year budget included $7.6 million in funding for recovery community organization grants, improved access to recovery housing, and additional resources and services to support individuals who are in recovery. In addition to developing our fiscal year 24 spend plan, which should include additional investment to support opioid strategy moving forward, we've been working on a website dedicated to keeping our stakeholders up to date on the opioid settlements and guidance. This will include an overview and status of all the settlements, resources to support implementation of local opioid abatement strategies, allowable uses for funds and resources to help in the creation of strategies and spend plans, a request form for accessing no-cost technical assistance for local governments, a detailed description of state opioid abatement investments, program monitoring and evaluation dashboard for state initiatives, and information on equity-specific investments and equity considerations in all investments. Before this goes live, however, if you are interested or have a coalition of local governments or other organizations who have settlement dollars and are looking for a way to partner together for more of an impact on those funds, just let us know and we can help provide facilitation and technical support right here and now. This progress could only have been achieved by our work together, and while we know there is so much more work to do to continue to improve paths to successful recovery, it's always important to take a moment to reflect on where we've been and where we are today as we look to the next steps and future of our response. And emergency departments will remain important access points for treating people with opioid use disorder and to connecting people to additional care and services. To everyone in this room, from community foundations and organizations to healthcare providers and payers, thank you for everything that you do. Thank you for being part of this model initiative and for participating today. You are critical partners in overcoming Michigan's opioid public health crisis. So on behalf of Governor Whitmer and our entire department, we look forward to continuing to working with you. Thank you.